Seniors, what's the best blood pressure for older adults? Know the truth. 3 weeks ago, groundbreaking research was published, research that is poised to ignite a firestorm of debate within the medical community because it profoundly challenges deeply ingrained beliefs about blood pressure that have been held for decades. For an extensive period, the prevailing advice from physicians has been remarkably consistent. Strive for a blood pressure reading of 120/80. This figure has been widely promoted as the ultimate objective, the hallmark of perfect cardiovascular health, with the underlying assumption that lower is invariably better. However, this pivotal study, which meticulously followed the health trajectories of over 15,000 individuals aged 75 and above, unearthed findings that are nothing short of astonishing. The research revealed that those seniors who successfully achieved or maintained blood pressure within the coveted 120/80 range actually exhibited higher incidences of falls, bone fractures, and ultimately mortality when compared to their counterparts who maintained somewhat elevated blood pressure readings. Dr. Robert, a medical professional with profound insights into geriatric health, recounted a deeply poignant personal experience that underscores this critical revelation. She witnessed firsthand the tragic demise of a 78-year-old woman, Margaret, just 6 months after her physician had diligently guided her blood pressure down to what was then considered the ideal perfect number. Margaret experienced a debilitating fall, resulting in a fractured hip, an injury from which she tragically never recovered. Her passing was not attributed to a cardiovascular event like a heart attack, but rather a direct consequence of blood pressure that had been rendered excessively low. By the conclusion of this comprehensive discussion, you will gain a clear understanding of the blood pressure ranges that are demonstrably safe and beneficial for individuals within different age brackets, specifically for seniors. You will learn about the precise ranges that have the potential to significantly enhance your well-being and even save your life. However, I am deliberately withholding the exact numerical targets for a brief moment. My intention in doing so is not to be evasive, but rather to ensure that you grasp the fundamental reasons why these targets differ for older adults. It is crucial for you to fully comprehend the adverse consequences that can arise when blood pressure becomes too low in the elderly population. You need to absorb the complete narrative, the full context, before I furnish you with the specific blood pressure ranges that your healthcare providers should be aiming for. Before we delve further into the intricacies of this vital subject, I urge you to pause for a moment and reflect on someone you know whose doctor persistently increases their blood pressure medication. Consider your mother, who frequently experiences dizziness. Think of your father, who suffered a fall just last month. Perhaps it's a friend who struggles to stand without bracing themselves against furniture for support. Please share this video with them immediately and critically subscribe to this channel. The information I am about to impart could very well be a lifeline, a literal lifesaver for them. Allow me to recount Margaret's full story, for it is a narrative that has the power to fundamentally transform your perception of blood pressure forever. Margaret was 78 years old when our paths first crossed. For a decade, she had been actively managing a diagnosis of high blood pressure, initially identified when she was 68, at which point her readings were around 152/88. While not considered alarmingly high by some standards, her doctor promptly initiated medication therapy. Within 2 months, her blood pressure had descended to 138/82. Excellent progress, her doctor proclaimed, yet he reiterated the need to reach the benchmark of 120/80, emphasizing this as the optimal state for protection against heart attacks and strokes. To achieve this, her dosage was escalated. Another 2 months elapsed, and Margaret's blood pressure settled at 128/76. She was getting closer, her doctor noted, but still not at the designated goal. Consequently, a second medication was introduced. "We really need you to be at that ideal number, 120/80, he urged, citing that this target was universally endorsed by all medical guidelines. Margaret, a woman of deep trust and a long-standing patient of her physician for 2 decades, had never experienced reason to doubt his counsel. If he declared 120/80 to be the objective, she wholeheartedly believed him. She diligently adhered to her prescribed medications, diligently monitoring her blood pressure at home on a regular basis. After an additional 2 months, her pressure finally registered 122/78. The doctor was ecstatic. "This is precisely where we want you," he declared, encouraging her to maintain her current regimen. Initially, Margaret felt largely unremarkable, perhaps experiencing a mild increase in fatigue, which she attributed to the natural course of aging. However, a disquieting pattern began to emerge. Upon rising from a seated position, she would experience a fleeting bout of dizziness, lasting only a few seconds, accompanied by a subtle spinning sensation. She found herself instinctively reaching for support to steady herself until the feeling subsided. She mentioned this symptom to her doctor during a subsequent appointment. He casually dismissed it as an age-related phenomenon. "Your blood vessels have likely lost some of their elasticity," he explained. "It simply takes your body a moment to recalibrate your blood pressure when you change positions. It's entirely normal at your age. Just make sure you stand up gradually, taking your time." Margaret diligently followed his advice, adopting a slow, deliberate approach to standing. Yet the dizziness persisted, manifesting every single time she transitioned from sitting to standing. Each morning upon arising from bed, each time she moved from the sofa, the disorienting sensation would return. Now, I invite you to participate actively by commenting below with your current blood pressure readings and your age. Please provide just the numbers, for example, 145/85, age 72, or 128/76, age 68. Your input is invaluable, as it allows me to ascertain the actual blood pressure ranges individuals are currently experiencing, which is critically important for what I am about to reveal next. Margaret's apprehension began to escalate concerning her simple act of standing. She would find herself mentally preparing herself before each attempt to rise. Her daughter, during a visit, observed this unusual caution. "Mom, why are you moving as if you're afraid of something? What's going on?" she inquired. Margaret confided in her daughter about the persistent dizziness. Deeply concerned, her daughter urged her to inform her doctor, emphasizing that the symptoms were worsening. Margaret contacted her doctor's office, leaving a message. The nurse returned her call the following day. "The doctor says," the nurse relayed, "as long as your blood pressure numbers are good, the dizziness is likely just a normal part of aging. Make sure you're drinking enough water throughout the day, as that can help with lightheadedness." The dizziness, however, showed no signs of abating. Then, one fateful morning, a mere 3 months after her blood pressure had been successfully brought down to the esteemed 122/78, Margaret awoke at 3 a.m. with an urgent need to use the restroom. She sat up in bed, swung her legs over the side, and began to stand. The room spun with an intensity far greater than she had ever experienced. Her knees buckled beneath her. In a desperate lunge for stability, her hand reached for the nightstand, but tragically, it missed its mark. She fell with a resounding thud. Her right hip struck the sharp corner of the nightstand with brutal force as she descended. She lay sprawled on the floor, an agonizing cry escaping her lips, utterly unable to move her right leg. Her husband, roused by the commotion, rushed into the bedroom to find Margaret in immense pain, incapacitated. He immediately dialed 911. Paramedics arrived with remarkable speed. They checked her blood pressure while she was lying on the floor, registering 118/74. As they carefully assisted her to a seated position, they rechecked 94/62. Upon helping her to stand, supported, a third reading was taken, 82/54. The lead paramedic recognized the gravity of the situation instantly. "Severe orthostatic hypotension," he declared. "Ma'am, your blood pressure is plummeting dramatically when you change positions. The medications have lowered your pressure so significantly that your body is unable to sustain adequate circulation when you stand. Your brain was not receiving sufficient blood supply. This is what caused the dizziness, and this is what led to this fall. At the hospital, X-rays confirmed the worst fears: a complete fracture of the hip. Surgery, a total hip replacement, was unavoidable. However, at 78 years old, surgery carries substantial risks, including infection, blood clots, pneumonia, stroke during anesthesia, and complications arising from immobility. Despite these formidable challenges, the orthopedic surgeon explained that there was no alternative. Without the surgery, Margaret would forever be confined to a non-ambulatory state. The operation was scheduled for the following morning. The surgical procedure itself proceeded without incident. However, the subsequent recovery was arduous. Margaret endured a week in the hospital, followed by 3 weeks in a rehabilitation facility, painstakingly relearning to walk through daily, exhausting physical therapy sessions. Prior to her fall, she had been entirely self-sufficient, managing her household, preparing her own meals, driving herself to the grocery store, and actively participating in social engagements. Now she required assistance with every facet of her daily life, from dressing and bathing to simply moving from one room to another. It felt as though she had aged 2 decades overnight. Upon her discharge home after 4 weeks, Margaret was a changed woman. She was consumed by fear, reluctant to move without her walker, terrified of being alone lest she fall again, and hesitant to make any sudden movements. Her daughter moved in to provide constant support and assistance with her daily needs. Margaret's world had irrevocably shrunk. Before the fall, she had been vibrant and engaged, enjoying weekly grocery excursions, Sunday church services, regular lunches with friends, and active participation in her book club. Now, her confinement to her home was almost absolute, a prisoner of her fear, her diminished strength, and her newfound fragility. The most heartbreaking chapter of Margaret's story unfolded 6 months post-fall. She developed pneumonia. The prolonged period spent sedentary in chairs and confined to bed, coupled with her fear of movement, had unfortunately led to fluid accumulation in her lungs. Pneumonia in a 79-year-old with severely compromised mobility is an extremely perilous and often fatal condition. Margaret was rushed to the hospital, administered intravenous antibiotics, and placed on oxygen. Sadly, her lungs proved incapable of expelling the infection. Her body, weakened and deconditioned by months of limited activity and pervasive fear, was too frail to overcome the illness. Margaret passed away just 3 days after her admission to the hospital. Her daughter, utterly devastated, was consumed by a profound sense of anger. "My mother was perfectly fine before they aggressively lowered her blood pressure," she lamented through her tears. "She was active, independent, and content with her life. Then they pushed her down to that magic number of 120/80, and everything unraveled. She started experiencing dizziness, then she fell. That fall initiated a catastrophic decline that ultimately led to her death, all because her blood pressure was too low. But her doctor consistently insisted that 120/80 was perfect. How can a perfect number lead to someone's death? This is precisely the question we must confront. How can a supposedly ideal blood pressure reading be fatal? The answer lies in the stark reality that 120/80 is not universally perfect. It is particularly problematic and demonstrably dangerous for seniors over the age of 65. For older adults, aiming for this benchmark can be outright perilous, leading directly to the very same devastating cascade of events that befell Margaret: dizziness, falls, fractures, decline, and ultimately death. Now, if you experience dizziness when you stand up, please comment the word dizzy. If this happens to you regularly, your input is crucial because this is a critical warning sign that your blood pressure might be dangerously low for your age. Your body is, in essence, sending out a desperate alarm signal that something is fundamentally wrong. Margaret's tragic demise was entirely preventable. Had her physician recognized that 120/80 was too low a target for a 78-year-old woman and instead pursued a higher reading, Margaret would undoubtedly still be alive today. She would still be walking, still be independent, still be cherishing moments with her grandchildren. But her doctor, bound by outdated guidelines that failed to account for age-related physiological changes and treated an 80-year-old body with the same assumptions as a 40-year-old body, was unaware of this critical nuance. So, what constitutes the appropriate blood pressure for seniors? What numerical target should you truly be striving for? I am about to provide you with the exact ranges. However, it is imperative that you first grasp the fundamental reasons why seniors' physiology differs, and why the standard, one-size-fits-all approach simply does not apply to older adults. The primary factor contributing to this difference is the natural stiffening of blood vessels. As we age, our arteries progressively lose their elasticity, becoming more rigid. This process, known as arteriosclerosis, is a normal consequence of aging and affects everyone. Stiff arteries are less adept at expanding and contracting in response to blood flow compared to the supple, flexible arteries of youth. Imagine the contrast between a new, pliable rubber band and an old, brittle, dried-out one. When your heart contracts to pump blood, these hardened arteries are less effective at absorbing and distributing the pressure wave. Consequently, a slightly higher baseline blood pressure is required to ensure adequate blood flow to all vital organs, with particular importance placed on the brain, which is situated at the apex of the body and must constantly contend with the pull of gravity. For a young individual with flexible arteries, a blood pressure of 120/80 provides ample pressure to maintain robust blood flow to the brain, even when changing from a lying to a standing position. However, for an older individual with stiff, unyielding arteries, this same reading may be insufficient. When they stand, their inflexible vessels struggle to adapt quickly enough, leading to a sharp drop in blood pressure and a subsequent reduction in blood flow to the brain. This sudden decrease is what precipitates dizziness, loss of balance, and ultimately falls. The second crucial reason for the disparity in seniors relates to diminished sensor sensitivity. Embedded within the walls of our blood vessels are specialized sensors called baroreceptors. These sensors continuously monitor pressure fluctuations and transmit rapid signals to the brain, prompting immediate adjustments in heart rate and blood vessel constriction. In young, healthy individuals, these baroreceptors respond within fractions of a second. Upon standing, they swiftly detect any minor drop in pressure and instantly signal the heart to increase its beating rate and the vessels to constrict slightly. This automatic reflex action maintains stable blood pressure and effectively prevents any sensation of dizziness. However, with advancing age, the sensitivity of these baroreceptors significantly diminishes. Their responses become sluggish, akin to reflexes that have dulled over time. Therefore, when an older adult stands, their slower-acting baroreceptors fail to react promptly. If their blood pressure is already on the lower side, such as 120/80, and their baroreceptors are slow to respond, they will experience a dangerous pressure drop for several critical seconds before their body finally manages to compensate. This delayed response is medically termed orthostatic hypotension, and it is a direct precursor to falls. The third critical factor involves altered medication sensitivity. Older adults metabolize and eliminate medications at a different rate than younger individuals. Kidney function naturally declines with age, as does liver function and body fat composition changes. These physiological shifts mean that medications can persist in an older person's system for a considerably longer duration and exert a much more potent effect. A dose of blood pressure medication that is perfectly safe and effective for a healthy 50-year-old might prove to be excessively strong for an 80-year-old taking the exact same pill. This can result in an undue and dangerous lowering of blood pressure to levels that their body cannot safely manage. The fourth and final critical reason why older adults necessitate different blood pressure targets is that they face fundamentally distinct health risks. In younger individuals, the primary threat posed by high blood pressure is the cumulative damage inflicted over many decades. This involves a gradual deterioration of the heart, kidneys, and the blood vessels supplying the brain, leading to heart disease and kidney disease that progress over years. However, in older adults, the immediate risk associated with excessively low blood pressure can significantly outweigh the theoretical long-term risk posed by moderately elevated pressure. A severe fall, precipitated by low blood pressure, can be fatal for an 80-year-old within a matter of months. Conversely, blood pressure readings of 140/85 might not present any immediate problems for many years, or potentially ever. Therefore, the entire risk-benefit calculation undergoes a fundamental shift with age. For a 50-year-old with decades of life ahead, aggressively targeting 120/80 is a logical approach, as preventing long-term organ damage is paramount. However, for an 80-year-old, preventing an immediate fall that could jeopardize their independence or even their life might be far more critical than achieving a seemingly perfect number on paper according to textbook standards. At this juncture, I know you are eagerly awaiting the precise numerical targets. What should your blood pressure goal be if you are 65, if you are 75, if you are 85? I am about to provide you with these specific ranges. However, it is essential that we first examine the actual research findings, as these insights are surprisingly contradictory to what most physicians have been taught and continue to convey to their patients daily. The traditional guideline, which advocates for a universal target of 120/80 regardless of age, originated from extensive studies conducted primarily on middle-aged adults, individuals in their 40s, 50s, and early 60s. These studies unequivocally demonstrated that lower blood pressure significantly reduces the incidence of heart attacks and strokes within this demographic, and this finding remains unequivocally true for middle-aged individuals. The critical flaw, however, lies in the fact that very few of these seminal studies specifically included participants over the age of 75 or 80. They lacked a sufficient number of very elderly participants to draw reliable conclusions. The limited number of studies that did specifically investigate older adults yielded completely unexpected results, findings that directly challenged decades of established medical dogma. Recent research followed thousands of real-world individuals over the age of 75. This cohort was not comprised of selectively chosen, exceptionally healthy seniors, but rather included typical older adults, encompassing those with pre-existing conditions such as diabetes, a history of strokes, kidney disease, and general frailty. These individuals were tracked for several years, and their health outcomes were meticulously compared based on their average blood pressure readings. The results were profoundly surprising. Among adults over 75, those with systolic blood pressure readings between 130 and 140 exhibited the lowest mortality rates. Their death rates were lower than those with blood pressure below 120, and also lower than those with blood pressure exceeding 150. Conversely, the group with systolic pressure consistently below 120 demonstrated measurably increased risks of falls, fainting episodes, acute kidney injury, hospitalizations, and death, while the group with readings above 150 showed elevated risks of stroke and heart attack, which was not entirely unexpected. The sweet spot, the blood pressure range associated with the longest survival and the highest quality of life, was firmly established between 130 and 140, not 120, not 110, but consistently within the 130 to 140 range. The researchers themselves were genuinely taken aback by these findings, as they directly contradicted their extensive medical training. However, upon careful reanalysis of the data and consideration of the underlying physiology, the results began to make perfect sense. For older adults characterized by arterial stiffness and slower reflex responses, maintaining a moderately higher blood pressure than the traditional target actually facilitated improved and more consistent blood flow to vital organs, particularly the brain. This higher pressure effectively prevented dangerous drops during positional changes and significantly reduced the risk of falls. These tangible, immediate benefits demonstrably outweighed any theoretical, marginal increase in long-term cardiovascular risk associated with slightly higher readings. However, I am still withholding your specific target number because it is not a universal constant. It is influenced by your individual age, any coexisting medical conditions, your overall health and fitness level, and whether you are considered robust or frail. The ideal blood pressure for a healthy, active 68-year-old will naturally differ from the optimal reading for a frail, unwell 82-year-old. Allow me to illustrate this point with the case of Harold. Harold was 72 years old when I first encountered him. His blood pressure had been hovering around 146/88 for several years. His primary physician, however, was intent on lowering it further, aiming for the standard 120/80 target, and accordingly initiated medication. After just 2 months of treatment, Harold's blood pressure had decreased to 124/78, remarkably close to the desired goal. Mission accomplished, one might think. Tragically, this was far from the case. Harold began to feel absolutely dreadful. He experienced persistent fatigue, became dizzy every time he stood up, and found it impossible to concentrate, often feeling as though his mind was enveloped in a constant fog. His overall quality of life had plummeted. I conducted a thorough review of Harold's comprehensive medical history. Apart from his blood pressure, he was remarkably healthy for his age, maintained a very active lifestyle, had no history of diabetes, heart disease, or kidney problems, and possessed excellent kidney function for a man of 72. For an individual like Harold, his baseline blood pressure of 146/88 was likely not posing any significant danger. The medications, however, were clearly inducing severe and unacceptable side effects. We carefully reduced his medication dosage, allowing his blood pressure to gradually rise to 136/82. Within 2 weeks of this adjustment, Harold reported a dramatic improvement in his well-being. His energy levels fully returned, the dizziness completely disappeared, and his mental clarity was restored. His blood pressure reading of 136/82, while moderately higher than the textbook target of 120/80, was perfectly safe and appropriate for a healthy, active 72-year-old man. Now let me introduce you to Ruth, a case that exemplifies the other end of the spectrum. Ruth was 83 years old, frail, and managing multiple serious medical conditions, including heart failure, diabetes, and chronic kidney disease. Her blood pressure was reading around a 168/92, which was undeniably elevated. Her cardiologist strongly advocated for aggressive lowering of her blood pressure through a regimen of multiple medications. However, I strongly disagreed with this approach. For Ruth, in her specific circumstances, aggressively reducing her blood pressure carried a significant risk of causing more harm than good. She was already quite weak, extremely unsteady on her feet, and at an exceedingly high risk for severe falls. Significantly lowering her blood pressure with potent medications could easily have pushed her past the tipping point, leading to a catastrophic fall. We made a deliberate decision to allow Ruth's blood pressure to remain at approximately 160/90. While this reading was considerably higher than traditional textbook targets, for Ruth, given her advanced age, her frailty, her multitude of health issues, and her elevated fall risk, it represented the absolute safest course of action. She remained stable throughout this period, experiencing no falls and no hospitalizations. Her quality of life was preserved. 5 years later, Ruth was still alive, continuing to live independently in her own home and manage her daily activities. Her blood pressure had remained consistently around 160/90 during that entire time. I am firmly convinced that if we had aggressively pursued lowering it to 120/80, Ruth would have likely suffered a fall within months, sustained a serious fracture, and quite possibly passed away much sooner. Now please comment with your age and indicate whether you have diabetes, heart disease, or kidney disease. Use this format: 72 diabetes, or 68 none, or 80 kidney disease. I need to see the range of health profiles people are dealing with to fully comprehend the overall picture. Let me now elucidate a crucial distinction between systolic and diastolic blood pressure, as this is a point of confusion for many. Most discussions concerning blood pressure targets focus almost exclusively on the systolic reading, which is the upper number. This represents the pressure within your arteries when your heart muscle actively contracts and pumps blood. Diastolic pressure, the bottom number, reflects the pressure when your heart muscle relaxes between beats. For older adults, the systolic pressure generally carries significantly more weight than the diastolic pressure in most clinical scenarios. As we age, systolic blood pressure tends to rise, primarily due to the progressive stiffening of the arteries. In contrast, diastolic pressure often remains relatively stable, or may even experience a slight decrease. This phenomenon leads to what medical professionals refer to as a widened pulse pressure, where the numerical difference between your systolic and diastolic readings gradually increases with age. For example, a typical 70-year-old might present with a blood pressure reading of 150 over 75. This equates to a pulse pressure of 75 points. This pattern is entirely normal for that age group and simply reflects the natural hardening of aging arteries. What is critically important to avoid in older adults is very low diastolic pressure. If diastolic pressure drops significantly below 60, it can substantially impede blood flow to the heart muscle itself during the vital relaxation phase between beats, potentially leading to serious cardiac complications. Margaret's blood pressure at the time of her tragic fall was 122 over 78. Her systolic reading of 122 was already lower than what might be considered ideal for a 78-year-old woman, but her diastolic pressure of 78 was actually within an acceptable range. The real problem became acutely evident when she stood up. Her systolic pressure plummeted to a mere 82, and her diastolic pressure dropped to a dangerously low 54. A diastolic pressure of only 54 is critically low. At such a reading, her heart muscle was not receiving adequate blood supply during its relaxation phase, and her brain was receiving insufficient blood flow when she was in an upright position. This severe drop was the direct cause of her debilitating dizziness and her fatal fall. Now, let's explore what transpires within your brain when blood pressure becomes excessively low. Your brain, situated at the very top of your body, requires blood to flow upward against the relentless force of gravity. In young individuals with highly flexible blood vessels and incredibly rapid pressure-sensing mechanisms, this gravitational challenge is virtually non-existent. However, in older adults, characterized by significantly stiffened blood vessels and slower responding sensors, maintaining truly adequate blood flow to the brain while standing necessitates a sufficient baseline pressure. If systolic pressure drops below approximately 110 in an older adult, blood flow to the brain measurably diminishes. While this reduction may not be severe enough to cause immediate structural brain damage, it is certainly sufficient to manifest in noticeable symptoms. These can include dizziness, lightheadedness, confusion, profound fatigue, significant difficulties with concentration, and impaired clarity of thought. These symptoms may initially be quite subtle, leading most individuals to dismiss them as merely a consequence of normal aging. However, they are in fact indicative of chronically inadequate blood flow to the brain, a direct result of excessively low blood pressure. Scientific investigations employing sophisticated brain imaging techniques have unequivocally demonstrated that older adults with very low blood pressure consistently exhibit reduced blood flow to specific regions of the brain. Over months and years, this persistent reduction in blood flow can contribute to measurable cognitive decline, including progressive memory problems, and an increasing difficulty with complex reasoning and problem solving. Some researchers now hypothesize that overly aggressive blood pressure lowering in seniors may actually be a contributing factor to the rising rates of dementia. While this theory remains a subject of ongoing debate and not all researchers have reached a consensus, the possibility is genuinely concerning and warrants serious consideration. Furthermore, there is a significant kidney-related concern to address. Your kidneys require adequate blood pressure to effectively filter your blood and eliminate waste products. If blood pressure drops too low, kidney function can be compromised, sometimes quite rapidly. Numerous studies have revealed that older adults whose blood pressure is lowered too aggressively can, in some instances, develop acute kidney injury because their kidneys are unable to function properly under insufficient pressure. Consequently, we must meticulously balance these competing factors. We aim for blood pressure low enough to mitigate the risk of stroke associated with chronic high pressure, but simultaneously high enough to ensure adequate blood flow to the brain and kidneys, and sufficiently robust to reliably prevent orthostatic hypotension and dangerous falls. This optimal balance point is consistently found to be at a higher level in older adults compared to their younger counterparts. Finally, I am prepared to provide you with the specific target blood pressure numbers. However, please bear in mind that these are general guidelines, not rigid, unalterable rules. Your personal, individual blood pressure target should ultimately be determined through a thoughtful and collaborative discussion between you and your doctor, taking into account your unique circumstances. For adults between the ages of 65 and 75 who are generally in good health and reasonably active, with no major underlying medical conditions, a sensible blood pressure target is a systolic reading between 130 and 140, and a diastolic reading between 70 and 85. This range provides adequate blood flow while still offering substantial cardiovascular protection. For adults between the ages of 75 and 85 who are in relatively good health overall, a reasonable target is a systolic reading between 135 and 145 and a diastolic reading between 70 and 85. You will note that this range is slightly higher than that for the younger age group, specifically due to the increased arterial stiffness and slower automatic reflexes typically observed in this demographic. For individuals over the age of 85, or for those who are significantly frail regardless of their actual chronological age, a sensible target is a systolic reading between 140 and 150 and a diastolic reading between 70 and 85. In this population group, the paramount priority is the prevention of dangerous falls and the preservation of quality of life and independence. The immediate risk posed by excessively low blood pressure and subsequent falls is demonstrably greater than the potential long-term risk associated with moderately elevated readings. For older adults who have been diagnosed with diabetes, have a history of stroke, or have established heart disease, blood pressure targets may need to be adjusted slightly lower than these general ranges, perhaps falling between a systolic pressure of 130 to 135. However, it is crucial to emphasize that these targets should still be definitively higher than the 120 mark. These individuals require especially diligent monitoring for medication side effects and any signs of orthostatic hypotension. Now, please comment to indicate which category you personally fall into. For example, comment 65 to 75 healthy, or over 85 frail, or 75 to 85 with diabetes. I am keen to understand the actual health situations people are navigating. However, what is even more critical than achieving any specific numerical target on paper is the avoidance of orthostatic hypotension. This is unequivocally the most vital aspect to address. If you stand up and your blood pressure experiences a dramatic drop, this is a serious red flag. It is a critical warning sign that your blood pressure may be dangerously too low for your body, or that your current medications are excessively potent. Here is precisely how you can accurately assess yourself for orthostatic hypotension at home. You will need a home blood pressure monitor. Begin by lying down flat for a full 5 minutes, ensuring complete rest. Then, measure and record your blood pressure. Next, stand up relatively quickly, in the manner you would typically do so. Immediately measure your blood pressure again while standing. Record these second readings. If your systolic blood pressure drops by more than 20 points, or if your diastolic pressure drops by more than 10 points, you definitively have orthostatic hypotension. For instance, if your blood pressure while lying down is 130 over 80, and upon standing it decreases to 105 over 68, this represents a 25-point systolic drop. This signifies orthostatic hypotension and is a dangerous condition, even if your initial reading of 130 over 80 while lying down appears perfectly acceptable. Such a dramatic drop upon standing indicates that your medications absolutely require adjustment. You are at significant risk of a fall. Margaret experienced severe orthostatic hypotension that went completely unrecognized and consequently untreated. Her blood pressure while lying down was 118/74, but upon standing, it plummeted to 82/54. This represents a substantial 36-point systolic drop. This was the direct reason for her constant dizziness and precisely why she fell and fractured her hip. If anyone, had diligently checked her for orthostatic hypotension earlier, this dangerous condition would have been identified well before the fall occurred. Let me share the story of Thomas to illustrate how rectifying this issue can be life-transforming. Thomas was 74 years old. His blood pressure readings were consistently 128/76. His doctor was extremely pleased with these figures, declaring them perfect numbers, textbook perfect. However, Thomas persistently complained of significant dizziness whenever he stood up. His doctor repeatedly dismissed his concerns, stating, "Your blood pressure looks great. The dizziness must be something completely unrelated, perhaps an inner ear problem." I requested that Thomas rigorously check himself for orthostatic hypotension at home, using the method I have just described. He performed the test. His blood pressure while lying down was 128/76, but upon standing, it dropped dramatically to 98/58, a 30-point systolic decrease. This indicated significant and dangerous orthostatic hypotension. We proceeded to reduce one of his blood pressure medications. His blood pressure while lying down then rose to 136/80, but his standing blood pressure was now 118/72, representing only an 18-point drop. This was a vastly improved situation. Within a single week, Thomas's dizziness completely resolved, and he reported feeling fantastic. His doctor remained somewhat uneasy with the 136/80 reading, remarking, "That's higher than the guidelines recommend." However, Thomas was no longer experiencing dizziness, nor was he at risk for falls. He felt healthy and robust. His quality of life had improved dramatically. This is what truly matters. Blood pressure is not merely a number on a chart. It is not solely about achieving a favorable reading in your medical record. It is fundamentally about how you actually feel, your ability to function effectively, your capacity to maintain your independence, and your susceptibility to a catastrophic fall that could tragically end your life. If this video has provided you with information that could prevent a fall, safeguard your independence, or even literally save your life, please share it immediately. Share it with your friends who are over 65. Share it with your parents. Share it with anyone you know who is taking blood pressure medications and experiencing dizziness, fatigue, or confusion. This information could be their lifeline. Subscribe to this channel because my mission is to provide you with accurate, up-to-date medical information that your own doctors may not yet be privy to. Medical guidelines evolve very slowly, and new research can take many years to disseminate into everyday medical practice. I am bringing you the most current information available right now so that you can make genuinely informed decisions about your own health. Please comment one of 3 options right now. Comment too low if you believe your blood pressure might be too low for your age after watching this video. Comment perfect if you are confident your blood pressure is within the appropriate range. Or comment talk to doctor if you plan to discuss adjusting your blood pressure targets with your physician at your next appointment. You now possess the true understanding of blood pressure targets for older adults. You know that 120/80 is not the correct target for everyone. You are aware of the specific target ranges for different age groups. You understand how to check yourself for dangerous orthostatic hypotension, and you know precisely what topics to discuss with your doctor. Utilize this knowledge. Advocate assertively for yourself. Do not allow anyone to impose a one-size-fits-all number upon individuals of all ages.